Hi guys, Rob Chronicles back again. Um, so I wanted to do my reaction to what the CDC just said about wearing masks for civilians. Now, if you don't know who I am or anything about me, I'm a former first responder, police officer, and I've worked in public service for lots of years. I've had to wear what they call PPE, which is masks, gowns, gloves, every hour, sometimes every second of my workday, at some point or time. Uh, these measures are taken to prevent infection and disease. It prevents my patients from getting anything that I might have, like a cold or cough or whatever, and it prevents me from getting whatever they might have. Masks are a tool used by medical professionals to make sure that the stop of any type of droplets or anything like that, you spit when you talk or you sneeze or cough, whatever it may be, the mask is there to catch that and not let it out into the general air so everybody else can get it or what. Now there's some masks that are super powered, like the N95 masks, and that will do that specific thing, and it will filter out that virus or that germ or whatever, and it'll specifically filter it out and be in the mask. So that's why you have to change N95 masks all the time. Plus, an N95 mask, you have to be fitted for it. You can't just go to the store and say, "Oh, the CDC said I could wear a mask. I want an N95 mask. Go to the store and buy it. Put it on." All right, it doesn't work that way. You have to be fitted for it. It has to have a nice seal around the bridge of your nose and down, and then around your face and your chin. It's got to be an airtight seal. And they put you in a hood, like a respirator hood, or a ventilator hood. I don't remember exactly which one it is. And they seal it up around your neck, and they pump air in there, and they see, can you feel it? If you can feel air on your nose or on your mouth or anywhere near that area, around this area here, you say yeah, and then so they get you a different mask, different size mask, and then you repeat the process all over again until you don't feel anything in that area. So that's the process of an N95 mask. And I felt I had to go into detail about that because everybody's like, "Oh, mask, mask, mask. I need a mask. I need a mask. I'm going to be saved with a mask." Okay, first of all, a mask isn't going to protect you from very much. Okay, it's a good tool. It is a tool basically to prevent the disease from getting it or from giving it to someone else. Okay, but other than that, that's all that it is. It's not the silver bullet. Okay, and a lot of reasons. There's two main reasons why medical professionals and CDCs and all this other stuff are saying that they want you to not wear a mask unless you're showing signs and symptoms. And that is because, one, we need to save the PPE for the frontline responders and caregivers, nurses, doctors, paramedics, EMTs, etc., etc. Okay, so if you don't wear a mask, then that's one mask more that they have in the system. Okay, now there's non-surgical masks, and the non-surgical masks go on and tie behind your head or whatever, those will keep your contaminants away from other people, and in a way it will have a small barrier of contaminants coming into your area as well. But if someone's sitting next to you and has tuberculosis and starts coughing all over you with a surgical mask, there is a high chance that you'll get tuberculosis or be exposed to it. So surgical masks really don't prevent infectious airborne things. That's the N95 mask. The N95 mask will do that. Okay? Now, I think what the CDC is saying, and my reaction to it is, it just doesn't make any sense, because people say, well, I'm going to go get a mask and I'm going to wear a mask. And most of them at the time, it's the surgical masks that they get and they put on, or the N95 mask that they put on without a seal. And they walk around and they think that they're protected and shielded from COVID-19. No, you're not. You can still get it. And I'll tell you why. Because you're going to play with that mask and you're going to fiddle around with it the whole time that you're wearing it. Okay? Now, you're going to adjust it. Okay? You could touch your eyes. You're going to put it down here to talk to somebody, forget, and leave it on your chin and not wear it. And someone's going to cough around you and you get exposed. You're going to scratch your nose, then your eye, then you're fiddling with it again, then you scratch your nose or your eye, or rub your mouth. That's the reason why they don't want you to wear masks, is because you still have the exposure to the virus. Okay? Now the CDC put out a thing saying, well, you can wear a non-medical type mask. Okay? That's great. That's a barrier, is all that it is. It's not going to prevent you from catching the virus. Okay? And the CDC should be more descriptive and informative on that. I've read the statement that they put out, and they've tried to be as informative, but I think a lot of it was political correctness too. So wear the barrier mask if you think you're going to be protected from COVID-19. Now, what I would like to see, and I think that the CDC should have been more descriptive. And it's just one of those face palms or one of these where you go, come on, man, common sense, be more descriptive, give people more facts. So that's my reaction to their statement on wearing a mask. Remember, it's a non-medical barrier mask. You can wear a scarf. You can wear a sleeve of a t-shirt that you cut. Okay? Those funny sleeves that go over your head and down over your nose and mouth and still shows your eyes, but has like the designs of like the skulls or the whatevers on there. You can wear something like that. Okay? You could wear a surgical mask. That's a medical mask, but it's a little bit easier to get a hold of. It's cheaper, and it's not taking an N95 mask out of the circulation for some first responder to not be able to use. So this is my rant about masks and the CDC and so on and so forth. And the non-medical barrier mask is what I'm going to call it. You're still at risk for the same reason as you would be if you wore a mask to begin with, a medical mask or whatever. And believe me, as a first responder, when I first was training, it's hard. It's hard because you're wearing this mask and you got gloves on, and you want to touch your face, or you want to touch your cheek, or you want to rub your eye because it itches. And I mean, you just had somebody's blood all over you, and urine or whatever all over you, vomit, whatever it may be, some bodily fluid, and you got that urge to get up there and rub your eye so you can take care of that itch. And you can't do that. You got to learn, you got to train yourself. And so first responders train themselves to do that. And that's why they can get away with it a little bit better, because they discipline themselves to not do that and not mess with that mask once they put it on. You put it on, feels comfortable, feels good, fits right, yada yada yada. You're done, go to work. So that's my rant. Okay? The non-barrier mask, I mean, you can wear a sock. You can cut the end off of your sock. If it'll go around your head, wear it. I mean, if you're that panicky and you're that, to me, it's you're giving into the fear that's out there. You're giving into the fear that the media and all these other garbage people are putting out there. Okay, if you don't have any symptoms, you really don't need a mask. You know, if you're around somebody that's coughing, stay out of that area. Keep a distance. I know that's restrictive. I know that's, why should you do it when they're, whatever. But you really can't ask that question now, because the question doesn't matter, because you could get the virus. You could be exposed. So who cares about the question? I really want to see you guys use common sense. So common sense dictates there's no symptoms, there's no mask. If there's a symptom, there's a mask. I mean, that's just the way that it is. If you feel so scared about it that you feel like your life is going to end and it's the end of the world and whatever, go out and get you a scarf, put it around your mouth. Get a bandana and tie it around your mouth like Jesse James or something. Do something like that and help yourself, because that's what you're doing, is you're helping yourself and you're comforting yourself by putting a barrier on like that. It's still not going to protect you like you think it will, but if it makes you feel good, I guess then that's half the battle. So this is Rob Chronicles. I just wanted to go over this stuff with you, my rant on the mask and the PPE, which, real quick, if you're using the same logic for a mask, what about the gown? Can you use that same logic for the gown, to wear the gown? So think about that and put some comments in there and let me know what you think. Because when you go in isolation, or you're dealing with an isolation patient or a patient that's got infectious disease or whatever it is, you have to wear the goggles, the gown, the mask, the booties, the all that stuff is what you have to wear. Now, is that what you want to wear when you go out shopping? Why? To look like an idiot? No, the gown acts the same way as the mask. It protects your clothing from the virus getting on your clothing. So it helps prevent you touching later on, touching your shirt or sleeve to adjust your collar or whatever, scratch your stomach or whatever it is, and then turn around and mess with your eye. That's what wearing a gown does, is it protects your garments that you're wearing, your shirt, whatever, from carrying the virus and spreading the virus. That's all the gown does. But once again, if you touch it, and you touch your eyes or your nose or whatever, you're exposed. So, yeah, these are things that professionals wear that are disciplined enough to wear them and make them effective. People running around with N95 masks and gowns and all this other crap, you don't know what the hell you're doing, so it's not effective. You're just infecting yourself. So do yourself a favor and get a barrier, because it's going to help your brain. Your brain's going to say, okay, I'm protected now. You're not, but your brain's going to say that, and that's going to calm you down a little bit. and calm is where you need to be. Calm is the heaven of reality. Calm. So once again, Rob Chronicles, make some comments below. I'll think of other topics, and I'll try and spit out some more blogs here pretty quick. All right, be safe, be vigilant. Talk to you later.